There it goes.
All right.
All right, Dr. Wilcox, we got a couple of important things to talk about.
Well, most importantly, I'm looking for patients for a study that is significant, and it has to do with macular degeneration.
Okay.
So I need to probably interview 80 to 100 people in order to find the 10 that I need. And so 50 to 80 years of age, dry macular degeneration. And I brought in one of the gizmos that we're using, this little thing that looks like the size of an iPhone or whatever it is. It has frequencies that are emitted from it into these goggles, which we place on the patient. And then there are some receptors, there's cathodes and anodes on this thing that have frequencies that pass through the eyes.
Now, is this something you created?
I've influenced this. There was a previous study done by Dr. Lori Chaikin where she took about 18 patients and exposed them to a more rudimentary form of this and improved their vision. Not all, but most, and significantly. And so I'm performing the feasibility study, it's called, here, and there's 4 locations in the country, one in Florida at a VA hospital here, and then 2 out in the West Coast. And patients, it's got an IRB for those people, the International Review Board. It's legitimate. There's a group that's smarter than a fifth grader that we're going to be using. We're going to be using on one leg of one arm of the study some of their frequencies, and their frequencies are pretty amazing. And that there's this one called Klotho, Klotho, and you go, what the heck's Klotho? Well, it's the name for a protein that we have in our body. So it's made in the kidneys and the brain, and it gets all around the body. And if you have a lot, you live longer. If you don't have a lot, you don't live long.
Is there a way to measure it?
Yes, and there's a way to actually make it too. So what's going on?
Is it measured when you get blood work done?
No, they got to use that. I don't want to mislead people. I don't know exactly how you assay and measure it, but it is measurable because it's a thing.
Only thing I was getting at there is why wouldn't somebody have...
yes, the answer is yes, and then you can find out. This is like with these DNA studies that go on today, because they can take blood out of you today and through some formulas, they'll tell you how long you're going to live.
Okay.
And so you can get it when you're 30, and you say, well, you're going to be 75 or some number like that. And if you have enough people and numbers, you can figure these things out.
Right.
Now, and you can make it. You can take this protein and inject it, or a tablet is given, and they're going through these things back at the research in the labs, and you can increase the longevity of somebody by 15 to 20%, and even 30%. So. The studies that were done on mice were there's this breed of mice that they genetically engineered them so that they'd have low Klotho, and said they were born old and they died young. So a mouse lives about 2 years, and these mice would live 1 year, and a miserable 1 year because they were born old and they died young. They took that same breed of mice and they increased their Klotho, and they lived 3 years. And so so a lot of human studies have gone on. And what the Klotho does...
What does Klotho have to do with
it's a protein.
What you're doing?
So, this is what Klotho does. So if you put it in your body near the boo-boo, you got a bad elbow, bad hip, bad heart, you name the thing, it causes stem cells to aggregate, to come to the party. And when the stem cells are there, we hear a lot of talk about stem cells. If we get stem cells in the body, it all helps. They're called totipotential, which means they can become anything. So if you put them by the organ, they turn into that organ. When you have an egg and a sperm and they come together, there's a replication of this, a division that goes on until they become things. So these stem cells are getting closer to that early stage in development, to where they can become whatever they happen to be in that neighborhood. And so this Klotho, if you expose it to the body, it improves that part of the body that's not well. And so if you can now take the signature, the fingerprint of the clotho, and there's also an insulin growth factor protein that's going to be used in this as well. And then you can put that in the eyes. Then that macular degeneration is going to improve because it's going to encourage these stem cells to come there and then improve that sick retina. And, and it'll work for anything, diabetic retinopathy.
So let's get down to the basics. You need to interview a whole bunch of people to find out if they qualify for your study.
Yes. And
so how
they come to the practice and they call up and they say, I'm in, one, they need to come in for an eye exam. And it's not a scam in order to get people in there, but I got to see you to see where you stand. And the Bank of Peter is funding all this stuff. It's not, we don't have, things that go on.
It took a second. Took a second. I didn't realize the bank. Okay.
Well, it's kind of how it works.
No. It just, my mind went, the Bank of, and then I realized.
Yeah. So what we do is yes, for the people who end up in the study, there's certain things that they'll be given in order to pass through the study, some nutraceuticals that are going to be tied to it.
But okay, I would doubt very seriously if I would qualify because my problem is I got more moisture in my eyes. It's not a dry eye.
Okay, we're doing the back of the eye, people who have dry macular degeneration.
So if I come in, are you going to ask me some questions?
Oh, yes.
To see if before you give me an eye exam?
We're more like, if somebody comes in and they just want to say, hey,
I heard about this study.
And, yes, we can, for no cost, we can sit here and do a quick evaluation.
Okay.
And kind of look and
That's
see.
That's
what
I'm asking.
Yes, without a doubt. Don't get me wrong on that. But and so we're more likely going to exclude you than include you,
right?
Because one thing you have to do is you have to be there 24 times in 3 months, twice a week for 3 months, and and because you have to come in, you have to be reliable.
But the thing is though that hopefully at the end of this study, you are going to be in much better shape.
Well, it depends. Now,
visually.
Now what?
I said hopefully. There's no guarantee.
With the study, some people get the juice, some people don't get the juice. Some people are getting this form of the juice, some people are getting that form of the juice, and that's how it works.
I gotcha. Okay.
And that's what makes a study legitimate. And it's called, and it's bad for an eye doctor to say this, but it's called the double-blind study. And it's like, oh, but that's the terminology used.
Okay.
To where there's some things where the patient doesn't know and the doctor doesn't know, but the clinician, the technicians doing this thing know. And so you don't want anybody like putting their finger on the scale to try to influence it.
Understand.
But all those things are accounted for. This is what goes on in the world of getting stuff straight. So the interesting thing is, in the United States, I'm the one location who's doing the pre-work on this with patients, and they're deeply appreciated going through this. And we're seeing improvements in their eyes.
Do you have people already started on this?
Yeah.
So you have people in the study already?
People in a pre-study.
Okay.
And because we're using some of this stuff that's been done in the past, and we're not using some of the new frequencies. And it's kind of interesting with these frequencies, you can emulate, you can. Like with this artificial intelligence where they make up a situation where you go, oh my God, that literally looks like Tom Cruise or whatever it is. Well, you can do that with frequencies, and these proteins and everything has its own resonant frequency. And if you trick the body to thinking the actual thing is there, when in fact, what is a thing? What is that feeling you have? When you see your mom, you go, oh, I have a feeling, and it's because you saw your mom. But if you saw your brother, you're gonna have a different feeling, just because of the type of loving you have for them. And so I try to take something complicated and make it simple for people. So each protein is made of a bunch of amino acids, and they all have these frequencies, and they're figured out. And when you just expose those frequencies, the little wavelengths, then it's as if it is there, and the body responds accordingly.
I have to break topic real quick. I had a question that was texted in that I didn't see before you left the last time. Sharon's mom has
Vitiligo.
Vitromacular
Vitreomacular degeneration.
traction syndrome.
Okay, yes.
What is it?
So in the back of the eye, you have the retina. And between the retina and the vitreous is a jelly in the back of the eye. You know, because your eye is a ball. So the ball isn't full of air. It's full of gooey vitreous that's clear. And I kind of say it's like clear apple jelly. You know, something clear that you go, okay. And as we get older, it starts to, just like your body starts to sag and everything else, well, your vitreous gets a little runny and it gets sloshy. And when you move your eyes around, instead of being firm jelly, it's sloshy jelly. And so you get this more movement there. Then you get these proteins that come together and it gets stringy. It's kind of like when you have soup and you're making egg drop soup and all of a sudden you get all this stringy stuff in there. So you can get these proteins that stick to the surface of the retina. And so that's the vitreoretinal adhesion. And then there's traction. It can pull and it can pull. I just had a guy in yesterday who has a hole in his back of his eye, in his macula.
Is it what she has? Is it curable?
Well, you can usually you just watch them, because if you're going to send somebody to a retinal surgeon to go do a peel, they can lose vision from it. So you have to make sure it's bad enough to justify the procedure. And matter of fact, some of our frequencies we're using address VMTs and VMAs and these vitreomacular traction adhesions and these epiretinal membranes, because they have a frequency they'll respond to.
But we have
right, so back
study
to
itself.
This person here. One, go get seen somewhere. I'm happy to be the person. Two, it depends how bad it is. And when you're looking at this, and I show people all the results of these
But I
scanning
mean, if
things.
people don't know they have this, like for example, Leah's sitting here and she's thinking, well, how do I know if I got what he's talking about? She can just stop in your office, say, I heard about the study. I don't know if I qualify, but I'm interested.
Well, in this study, one of the criteria is you're going to be between 50 and 80 years of age. We're trying to push that, maybe all 85. Right. So we're looking for people who have the problems that we want to focus on. But at the same time, if people don't have those problems, but they want to be exposed to these things, we're happy to do that, because that's where we get where we are by poking around and using things and trying them out. I currently have diabetics going through this, and epiretinal membrane, this VMT stuff you were just talking about. And there's all sorts of problems in the back of the eye. They all have different names, but it's aging, it's deterioration, it's inflammation, but this study is specifically looking at dry macular degeneration, because there's no cures for it right now.
Between 50 and 80 years of age, Dr. Wilcox is doing a study. It's on dry
macular degeneration, AMD.
Okay. If you're interested, stop in Dr. Wilcox's office. Just say, I don't know if I qualify for the study, but I'm interested.
Don't stop in, and you can stop in, but call up.
Call
to get in the queue, and because we need to allot the right time. So
so take some time to ask some questions.
Yeah,
before. Okay.
Right, and we're happy to do that.
Now let's talk about the fact that you're hiring.
Oh yes, we it's hard these days for any employer,
It is.
The truth is, and I'll say it.
That's why I'm still here. They can't find somebody.
Well, there's a lot of truth to that, because I was speaking to a patient who's a court stenographer, and they can't find people who want to do stenography, and they're sitting there typing away, and people don't want to learn it, and they make a killing because of what they do and how they do it, and don't get me wrong, but they're typing. They had to go figure out
code.
I know, I'm not belittling it, but the world out there needs help, and we're part of the world, and we're competing with the government with all these reasons people stay home, and because they're making more money staying home than they are going to work, and so the pool of applicants for everybody. I don't care who the heating and air people. Everybody's going through this, but we need somebody who's in the optical world. We can't sit around and start and train you from scratch. We've done that a bunch, and I don't have time for that. So an optician. or somebody who doesn't have necessarily an opticianry degree, but they have
Now,
a bunch
an
of
optician
years
simply
selling the
does-
glasses,
and
and
does-
you have to know your stuff.
They do the eye exams?
No, just the
Oh.
eyeglasses.
Oh,
You go
okay,
out there, find a
okay.
frame, get the lenses in there,
Okay.
and you have to know your stuff. So we're looking, and you put stuff out on Indeed, and I've been doing this for 30 some years, and just there's no responses out there because the pool is small, and it's smaller, and it's artificially smaller because of I'm competing against the government, and I shouldn't be. They want my taxes, right? And and they want all this, and they go, well, I kind of need people to help me get money to give you taxes.
Yeah.
And so we're looking, and Wilcox Eye Center, 804-642-9800. Somebody knows somebody who's qualified, and
Okay.
we're looking.
Would like to come to our area, even if they're outside the area?
Yeah,
Oh.
yeah.
All right. By the way, the jerky is excellent.
Thank you.
All right.
Thank you.
We'll see you in 2 weeks.
I'll be here.
Dr. Wilcox, everybody.